Hi, this is Dr. A with Intro to U.S. Healthcare. We are going to look at Chapter 7, Long-Term Healthcare Services from Basics of the U.S. Healthcare System by Nancy Niles. This is the second part of the lesson, and we're going to talk about paying for long-term care services. Okay, so what are the three ways that we pay for long-term care? Personal funds, your own money, Medicare and Medicaid, and long-term care insurance. Those are the three main ways, and we're going to explore all of those. So it is worth noting that Medicare does not cover most long-term care costs. Now, Medicare is accessible to everybody that turns 65, 66 now. You've usually been paying into it during your whole adult work life, and you have a right to Medicare when you reach retirement age. But you have to know that it does not cover long-term care costs, so that cannot be your plan. Individuals usually pay out of pocket for long-term care services until their personal funds are depleted, meaning until they are broke, and then they can access Medicaid to pay for them. And Medicaid, the federal government does a look back to see what you've been doing financially also. So they frown on moving assets out of your name into kids' names and stuff. There are some rules around all of that you have to be really careful about. And so generally people end up using their retirement money to pay for long-term care. And so you need to plan for that if that's going to be the option that you choose. So most continuing care retirement communities and assisted living facilities are paid for by the individual as a choice, although Medicaid can pay for the cost in some states, but I wouldn't count on it. And again, Medicaid is for people who are broke, who are poor, that don't have any money, right? And so ideally, you don't want to be in that state when you reach retirement. The Veterans Administration may help with paying for long-term care costs incurred by disabled veterans. Again, you have to look at the benefits and if you're getting such benefits as a veteran. Medicare covers medically necessary short-term or acute care, such as doctor's visits, prescription drugs, and hospital stays. That is what Medicare was intended for. It has never been intended to pay for long-term care. Medicare will pay for physical therapy for conditions that will be improved. So you have to have this angle of getting better, getting more vulnerable, increasing mobility for physical therapy to be covered by Medicare. Medicare does not pay for the largest part of long-term care services, such as help with those activities of daily living, which were like bathing, getting dressed, eating, going to the bathroom, etc. It will pay for a short-term stay in a skilled nursing facility or a home health care if certain conditions are met. Again, it's a short-term thing. So think about, for example, stroke recovery, where there's some recovery possible. We can, after a stay in some therapy and all of that, it's planned that the person should be able to go home and function pretty independently at home. The Older Americans Act in 1965 has federal programs that provide home and community-based services to older adults. And so these are a type of long-term care, and they are provided by state and local agencies. They include in-home personal care, meals in the community, and for the homebound, local transportation, respite care such as adult daycare, and services for older Native Americans. Again, and so these are type of long-term care services that also then need to be paid for, even if they are community-based. There is a cost there. So these programs tend to be targeted to low-income, frail, disabled, or minority older adults and older adults living in rural areas. Usually because they're also eligible for Medicaid, and that can help cover a lot of these programs. Now, another way to pay with, and this is kind of a personal funds money situation, is the annuity. So it's a series of payments over a specified period of time. If you enter into a contract with an insurance company for an annuity, it could help pay for long-term care services. So an immediate long-term care annuity consists of a specified monthly income in return for a single premium payment. Deferred long-term annuities consist of a specified monthly income for a specified time period, and these annuities are available to individuals up to age 85. Again, it provides them money to be able to pay for those things. Life insurance policies can also be purchased so when you get a life insurance policy, you get a life insurance policy for the people that will survive you when you pass away. So they're meant to protect a beneficiary, so that usually is a spouse that's living, that's with you, that where you're both doing life together and you are relying on each other's income, right? If you are a parent and you have younger children at home, that is also to protect them as beneficiaries. Or the person that might have to care for them. And so this is in the event of the death of the insured. You don't have to have life insurance if you have wealth, if you have savings that will take care of those needs, then there's no need for a life insurance. But a lot of people will purchase life insurance. Again, this is to benefit the beneficiaries that are named on the life insurance after the person that is insured dies. They typically provide a lump sum to the beneficiary. So some life insurance policies have an accelerated death benefit, and they provide cash advances while the policyholder is still alive. So the amount that they provide ahead of the death is then taken from the life insurance policy and subtracted from the amount due to the beneficiary. So let's say you had a $100,000 life insurance policy. You needed $50,000 to pay for long-term care. So you get an accelerated death benefit of $50,000 to help pay for the nursing home or whatever it is that you need. And when you pass, your beneficiaries only get the remainder of the other $50,000. So what was left in the policy that you didn't already take out with the accelerated death benefit. So the rules are accelerated death benefits are available if the policy holder lives permanently in a nursing home, is terminally ill, needs long-term care for an extended period of time, or has a life-threatening diagnosis such as AIDS. So those are the rules to allow an accelerated death benefit. You can also sell an insurance policy back to the insurance company for its current value. So that's an option to raise cash to pay for the nursing home or for the assisted living. So this is known as a life settlement. It is available to people that are 70 and older. The proceeds are taxable like income and can be used for any purpose, including long-term care services. You can also use it to pay off debts, etc. Of course, then if you are doing it with the idea of paying for long-term care services, you have to make sure that the money then goes to what it was intended. So as the population lives longer, more people will need long-term care services. However, the majority of Americans do not plan for long-term care. The majority of Americans aren't planning well for retirement, right? And they rely heavily on government programs. But government programs only account for about 63% of long-term care funding, with Medicaid providing 40% of that amount and Medicare the other 23%. Meaning like 40%, that means like almost half of the people that need long-term care are broke and they are poor. They don't have the money to pay for it. And so I would encourage you to get yourself in a situation where that is not you when you are at that time. So to plan, it's worth knowing that currently, nationally, the median annual cost of a private home in a nursing home is more than $90,000. That's for 1 year. And the average length of stay is 2.5 years. So these are just averages. Yours could be shorter, longer, who knows. So ideally, for long-term care, if you're going to be in a nursing home, you need to plan for at least $300,000. And so that's something that if you're going to pay for yourself, and you can plan, with having retirement money, etc. You need to plan to have enough. The federal government has been looking at the issue and looking at different alternatives to purchase long-term care insurance, those different options. So one of the things they thought about, could this be an employment benefit? But of course, a lot of the employers, they see, well, I mean, once an employee retires, it kind of no longer their problem. So employers haven't been really willing to get on to paying for long-term care for their employees. And then often the recommendation, we're going to talk about long-term care insurance. And so the recommendation is that you wait until you're 60 years old to start purchasing long-term care insurance. And so that's, towards the end of one's work career. So consumers have been concerned about the cost of their premiums going to waste if they don't need long-term care. And they purchase a long-term care insurance. And so they're like, well, yeah, I buy this insurance, but what if I don't need it? Am I just wasting my money? And so you can purchase a premium return rider on a policy, but it is expensive, of course. There are a more grassroots opportunity for the elderly is called community networks. The elderly can join, and there's usually a joining fee, so it does cost money. But it allows them to access some long-term care support services that are affordable. Again, but you have to have the money to pay for it, right? But it's an alternative to a skilled nursing facility. So instead of having to plan for, $90,000, maybe you can plan for like half that. So long-term care insurance was developed to cover services such as assistance with activities of daily living, as well as care in an organizational setting, so in nursing homes. So you can use long-term care insurance for a variety of different benefits. So home health care, hospice care, nursing home care. And so it is an insurance, so just like all insurance, the idea is that it covers you for the risk of having to spend all your retirement money on nursing home. And so the cost of your long-term care insurance policy can vary. It depends on the type and amount of services that you select, what age you are at the time of the purchase, and what is your healthcare status, like how sick are you, how likely you are to need it and need it soon. Again, the general recommendation is to wait till you're about 60, but ideally still healthy before you purchase long-term care insurance. Most long-term care insurance policies are comprehensive, which means they cover expenses anywhere from home health care, hospice care, respite care, assisted living, nursing homes, Alzheimer's special care, and adult daycare services. So the policy holder can select a daily benefit amount depending on the healthcare setting, with, again, some settings like the more care, the more 24/7 care you need, the more expensive it is. And the policy holder can select a lifetime amount for the policy, which can range from $100,000 to $300,000. So remember, we said $90,000 a year for stay at a skilled nursing facility, which is in the most expensive. Average stay 2.5 years, so $300,000 should cover that. So that's kind of in the top. $100,000 might be if you are planning on just doing in-home care with, the community support systems. The policy can also have a inflation option, which adjusts the coverage amount as you age because there's inflation. So the increased cost of living is kind of built into it. And some policies may even pay for family or friend long-term care for the policyholder, as in pay the family or friend to take care of the policyholder, right? And the policy may also provide reimbursement for equipment or for transportation. So those were all the options to pay for long-term care insurance, and we are going to look at current trends in long-term care in our third installment of this lesson, and I'll see you there.